Thank you for joining us on T&G. The Oxford Regis Professor of Medicine, Sir John Bell, told us on this programme a few weeks ago that the world, if not Britain, is still going up the mountain with coronavirus. We're not yet at the peak. Is that your view too?
That is, if you look at the figures, that's clearly where we are. I mean, the pandemic is raging in different parts of the world. It's increasing in certain parts of the world. There's the belief that it's in control of other parts of the world. You just mentioned the UK. But I would caution, as long as this goes on, be it anywhere else, there's a risk of new variants and mutations emerging, or I would say the certainty of that happening, but the possibility of risk of those starting to unravel what we have already seen. So I would be very sort of hesitant to join into the complacency that I think is spreading around in Europe at the moment and in the US to a certain extent. I think that's dangerous because that is not where we are when we look at the global situation.
Okay, just tell me which of the main countries or areas of the world that are most concerning at the moment where COVID is growing rapidly. We know about India. How about the rest of Asia, Africa? What is that looking like?
Well, I mean, you mentioned India, Nepal. There are places we don't know. I mean, who knows what's going on in Myanmar? Southeast Asia in general is subject to concern. Look at the figures of Latin America. If you look at May, the number of reported deaths, and reported, I mean, these are uncertain figures, but a third of what was reported in May of people losing their lives was in Latin America. Latin America is 8% of the global population, so you can see that it's fairly overrepresented there. And they have only vaccinated 3% of the population. So you can see that the potential is there for things to go very wrong indeed, and that will affect us as well.
And to just bring us up to speed again, can you tell us how much of the world's population is now vaccinated? Here, we've second dosed 47% of the population and first dose 74%. What are the figures globally comparatively?
I don't have any global figure, but I mean overall you can say that of the vaccines that have been delivered, if I have the figures right out of my head, I think roughly 85% of what has been done has been in high-income countries, and less than 1% in the low-income countries. And what we see now is, of course, is starting to hit the low-income countries and the middle-income countries all over the world. So we have a long way to go until we can say that we have vaccinated so far to say that we can be safe. And the priority at the moment is, of course, to get vaccines out to primarily those most exposed, say that health workers in Africa, so that they can cope with what might well lie ahead of those countries.
And just at the top of the interview, you used the word complacency, perhaps in Europe, perhaps in the United States, on what is happening over the world. It feels like we're exiting the pandemic now. The rest of the world isn't. But why do you use the word complacency? That's quite critical.
It is quite critical. No, I agree with it. It is. I see that as a substantial risk, that we in Europe and in North America, we think this is over. And it ain't over. Because first we are affected by the global economy taking a substantial hit by what is happening in other parts of the world. I think there was a very strong statement by the Director General of the IMF the other day, saying today vaccine policy or pandemic policy is the number one thing that we have to do in terms of economic policy to get it under control. And then the different variations, the mutations that are, I'm not a scientist, but I do listen to the scientists quite a lot. And they tell me, it is not a probability, it's a certainty that if this goes on, new versions, new variants, new mutations will appear. And we've seen them being, as we've seen in the British one and the Indian one now, so significantly more contagious. And perhaps at some point in time more dangerous.
Yes, on that point of it being more dangerous, you're saying these new variants are a potential concern and alarm to us here because these variants could potentially override all the vaccine that we've injected, that with all the success we've had here.
Could. I mean, no one can give you a certain answer to that. But I mean, we are fighting a living enemy. The virus, and that particular virus is adapting. I mean, that's the nature of that particular beast. And we've seen the British versions, the Indian versions, the Brazilian versions, the South African versions. We're now talking about something out of Vietnam. We don't know very much about that, but it's something that is a new sort of version of it. The new ones will come. And some might be sort of more easy to beat, and some will be more difficult to beat by existing vaccines. So there's, in my opinion, no place for complacency.
Okay, so moving on to the practicals, what is it exactly you're asking of big Western governments like the United Kingdom's?
Well, money. I mean, to be very practical. What is needed is, of course, money in order to be financing the vaccines. We do have production problems as well, but money is essential. You mentioned the testing that is necessary also in the low income and the medium income countries. Otherwise, we are flying blind. We don't know what's going to hit us. And then the therapeutics, the treatments, the oxygen, and the different things that you've seen in, for example, in the Indian situation, how devastating it has been not to have that. And all of that is going to require money, and money is going to come primarily from the rich countries. The UK has been generous. I'm not here to complain. I'm just saying that UK has a particular situation, a global leadership position with the G7 summit coming up, and most of that money will have to come from the G7 countries. I mean, that's the way the word. That's why they are the G7. By the way, they are supposed to take global leadership also when it comes to providing the money.
So I think you've got an ask of the Western world, if we can call it that, still, of setting up a vaccine pipeline to commit to providing 92 low middle income countries at least 1 billion vaccine doses by September this year and 2 billion by mid-2022. Very admirable targets. But is it just about money? Because I would have thought that the problem with vaccine supply is more about supply of the vaccine. There's a bottleneck in producing this stuff, and money isn't actually the issue. It's actually getting the doses to these parts of the world. So are you asking countries like Britain, other G7 nations, to start sharing the supply they actually have now as well?
No, it's true. I mean, it is money, no doubt about that. That is urgently needed. We are talking about sort of a deficit now in the order of $18 billion. But it's more than that. I mean, since it's going to take time to produce, sharing of vaccines, absolutely, as you point out. The EU promised the other day to share 100 million doses. The Americans have talked about 80 million doses. But these doses need to come, and come fairly soon. And then there are, as you point out, there are production bottlenecks. We still have different trade restrictions of different sorts. That means that, there are large vaccine producing facilities in the world that could do more, but there are trade restrictions that mean that they can't produce at full speed. So all of these things needs to be done, no question about that.
When you talk about sharing doses, you ask countries, and I think your words or WHO's words are, countries with an adequate coverage should then start committing elsewhere. What is adequate coverage? For example, are you okay if Britain waits until it's jabbed twice every single adult in the country? We're not there yet. We're nowhere near yet. In fact, probably won't be there till September. Or is adequate coverage just vaccinating people with 2 doses in the at-risk groups or over 50?
Yeah, good question. I don't have a precise answer to that. But I mean, if we take the choice between allocating scarce vaccine doses to, say, young, very healthy, very young people in, say, the US or Sweden or UK, and vaccinating health workers in Africa, I would allocate those vaccine doses to the health workers in Africa.
Right, because at the moment that's not the British government's policy. And if someone was to say to you in Britain, well, look, this vaccine, the AstraZeneca vaccine certainly, which is a very good and popular one, that was developed by British taxpayers' money. That was developed by the substantial help of the British government. Why should the British people not come first? Why can't we just dose up all our adults first and then be generous to the rest of the world?
Yeah, because you have to see also, I mean, apart from the moral aspect of it, the moral responsibility that we have, if you want to have a global leadership position for what's happening in other parts of the world, pure self-interest. As I said, with the pandemic raging in wherever we talked about, India or Brazil or Nigeria or whatever, the new variants will appear. Some of them might well be so dangerous that they will unravel everything that you've done in the UK or we've done in Sweden or in Italy, where I happen to be at the moment. So we have a profound self-interest also in making certain that it is contained in other parts of the world as well, because otherwise there's a risk of it sort of unraveling everything what we've done. Sorry to say.
No, that's your argument to make. Now, look, the G7 is meeting in 11, 12 days' time in Cornwall as well. You know,
Yeah.
it's the G7, a meeting of health ministers this week in London, albeit virtually. You've said already the UK has been one of the most generous benefactors to your pot of 38 billion that you want. You've still got an $18 billion shortfall. What more is it that you want from this G7 meeting? What do you want them to commit to? Do you want more money from the British government? You've said you'd like some doses already, but which are the G7 countries that haven't given as much as the UK perhaps should now get out their checkbooks?
Well, that's for the UK government to look at that. I don't have the exact figures, but as you say, I mean, the UK government has been generous, but there's certainly room for it to do more. And particularly when it has this leadership position at the G7, it has a particular responsibility. There's also a fundraising effort going on, which is led by the Norwegian and the South African governments that are trying to mobilize the money within primarily the G20 framework. But then, in all honesty, as said, with the G7 coming up, I mean, firm language and firm measures on the trade restrictions, firm language and firm measures on sharing vaccine doses, that's also needed. And the UK can play, and I hope it will play, a constructive role.
So you would like to see, for example, the G7, if you can possibly get them there, to commit to start sharing their doses, giving away their doses once they've vaccinated a certain level of their adult population, and perhaps not necessarily worrying about having to vaccinate all adults, those in their 20s, for example.
No, that's true. And you also have a situation, as you know, that both all of the Europeans and the US have ordered far more doses than they need. And that was a wise policy because, I mean, they ordered as much as they could in order to be on the safe side. And we didn't know at that time which vaccines would work. So there's going to be a very substantial surplus that is starting to appear in the rich world. And now is the time to start to discuss how to share that through the COVAX facility primarily. I'm saying that in order to avoid the vaccine diplomacy that we've seen from primarily the Russians and the Chinese and some others. We don't want to engage in that particular game.
Let me ask you about President Joe Biden's idea of relaxing patents to allow other countries to manufacture vaccines just as quick as the drug companies in the West can, perhaps. Do you agree? Is that a good idea? Is that the way forward?
We'll see. That's going to be a discussion now within the World Trade Organization. I think that's going to take some time because it's rather controversial. From my point of view, with sort of as you can see, the urgency that is in my voice when I discuss these issues, this is not the most important thing because even if there is an agreement to do this along the Biden lines towards the end of the year, it's going to take quite some time to build new facilities because most of the existing facilities that we have in the world are already producing. So building a new sort of greenfield factory wherever, we're talking about years. So that particular thing, pro or con, it's not going to be very relevant for this year or perhaps not even next year.
Okay, I want to bring in my co-presenter, Isabel, who's got some questions for you as well, Mr. Bildt. But let me just ask you about this first. The World Health Organization's investigation into the origin of COVID-19, the WHO, which of course you represent as a special envoy, did not identify Wuhan's Institute of Virology as the source of the outbreak. But the US government is far from sure. President Biden, as you know, has commissioned his intelligence agencies to find out if it is indeed the Institute of Virology. In your view, has the WHO failed to get to the bottom of this absolutely massive question?
I have no firm view on that because, but what I've asked myself is, do we know, are we exactly certain of the origin of the previous coronaviruses that we have had? I remember the SARS in 2003. It started somewhere in China as well. It was coming from animals. That's supposed anyhow, but I don't think there's any certainty. We had the MERS that was coming from somewhere in Saudi Arabia, I think. We've had several others. I mean, to be absolutely 100% certain of exactly how these coronavirus originate is, I understand, extremely tricky. Accordingly, you can have different theories, but to have absolute certainty. I understand that if I just read the American press or the US press, they don't have anything that really points at this Wuhan laboratory theory, but they can't exclude it. And that's, of course, in the nature of the beast.
Yep, indeed it is. But certainly, as far as you're concerned, the WHO might be concerned, the Wuhan lab could, and I emphasize could, still be a possible source as the original leak for the pandemic.
Well, I mean, as long as you can't exclude anything, you can't exclude anything. But as far as I read what's available to me, there has been found anything that points in that direction. There are other points in other direction, but it can't be excluded since nothing can be excluded, since we don't know.
Hello, Mr. Bildt. It's Isabel. Thanks for joining us. I wondered, as a former Prime Minister of Sweden, what you made of how the country has handled the pandemic.
Well, I think we, if I'm now in the Swedish situation, I mean, we have a lot to learn, obviously, so has everyone. I don't think we did it particularly well in the beginning, to be quite honest with you.
Well, in terms of the refusal to lock down in the way that other countries did.
Yeah, or restrictions. I mean, lockdown is a strong word. I mean, there are versions of that. Different. I think we were not sufficiently serious in what we did in the beginning, I have to say, and we see that unfortunately in the numbers of people who died in the beginning of it. It was much higher in Sweden than it was in our Nordic neighboring countries, and that's a tragedy. I think we have improved somewhat.
Why was that decision taken? Was it based on the economy? You've previously said that it was based on the science, but obviously other governments around the world were looking at the same science and taking a very different decision.
Yeah, science at that particular time was not. I mean, science is not always exact, and we were all uncertain in the beginning. I mean, so different governments were taking different approaches to it. Mm-hmm. And the Swedish government, for reasons that sort of eludes me, but ask them, took that particular approach. There was a cost in terms of lives associated with that one. You could say that we had a somewhat more leisurely life as Swedes back home in Stockholm. Mm-hmm. But there is, in Sweden as it is elsewhere, I guess, a public or an inquiry now that is going to look into the lessons. I'm quite certain that both in Sweden, in the UK and all over, there are hard and to some extent painful lessons that we have learned.
Let's talk about some hard and painful lessons that the UK has been learning over the past few months, not on COVID, but on Brexit. Have you been following the ongoing difficulties to try to get Brexit to work, both in our English Channel border and in Northern Ireland?
I do follow that, yes.
And what do you make of how it's been handled so far by the UK government?
Well, I mean, the UK government took the decision that they wanted a hard Brexit. Rightly or wrongly, in my opinion, wrongly, but I'm not a UK citizen, but that's another issue. And a hard Brexit is associated with hard problems. I mean, that's no surprise. And I don't think we've seen the end of it. And some issues, particularly the Irish issues, Northern Ireland, I mean, they are virtually without solution. And I fear we'll see more problems coming out of that. And what I see is a very regrettable rupture of cooperation in a number of areas between the rest of Europe and the United Kingdom. I think it's highly regrettable. I think it is long-term damaging for all of us, but that's where we are.
What about the way France has responded to the disputes over fishing rights in the Channel? That has been quite a breakdown in relationship as well. Should there have been such an escalation of tensions over fishing boats in Jersey?
Well, I have to confess that I'm not an expert on fishing rights in Jersey, and Jersey has a rather peculiar, as you know, situation within the UK constitutional framework. It's not part of the UK, as a matter of fact. I understand. My experiences as Prime Minister in the past is that there's virtually no international negotiations that can't be sort of broken down or even that doesn't risk break down over fisheries issues. I mean, there are few issues that are as I would even say poisonous, because even if fish is a very small component of the economies of whichever nation, it is associated with a lot of feelings. So you've had a lot of sort of very strong emotions from the UK government side, certainly on sort of it's our fish. And I think it was someone who said that the fish is now happier in the British waters than they were before. I can't judge that. And the French thinks that the French fishes are happier. And I mean, it's a subject where nationalism runs very rampant. I don't know if the fish are to be blamed for this, but that's a fact.
It's a fishy business.
It's a fishy business, and if the British fish are happy now, I'm happy with the British fish, as long as the Swedish fish is also happy. And I don't wish any bad on the French fish either, by the way.
Mr. Bildt, I think none of us expected the conversation to go down this route when we first started talking to you, but it's been very enjoyable.